Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid. Today's topic is venous drainage of the heart. Free medical education. Venous drainage of the heart. Name of the vein usually follows the name of its corresponding artery except the veins of the heart. In the heart, arteries are two coronary arteries and their branches. Veins are coronary sinus and its tributaries, the cardiac veins. Two coronary arteries and the coronary sinus run along the atrioventricular groove, sulcus, and circle around the middle of the heart between two atria above and two ventricles below. Branches from the coronary arteries ascend to the atria above and descend to the ventricles below and supply them. Tributaries of the coronary sinus, the cardiac veins, drain the atria above by descending and drain the ventricles below by ascending to the coronary sinus. Venous drainage of the heart. This is the posterior view of the heart. This is left atrium. This is left ventricle. This is right atrium. This is right ventricle. This groove or sulcus is between the left atrium and left ventricle. That is posterior atrioventricular sulcus. Now we are going to say about venous drainage of the heart. The venous blood from the wall of the heart is drained mainly by 5 veins that empty into the coronary sinus and partly by 2 sets of veins. The coronary sinus. What is coronary sinus? The coronary sinus is a wide and short venous channel of about 2 to 3 cm long. It is located in the posterior part of the atrioventricular groove between the left atrium LA and left ventricle LV. This is the coronary sinus located between the posterior surface of the left atrium and left ventricle. The coronary sinus runs from left to right along the groove and drains into the right atrium. Coronary sinus runs from left to right and drains into the right atrium. Opening of the coronary sinus. Let's see the diagram first. We are looking at the heart from the right side. This is the apex. The right wall of the right atrium has been removed so that you can see structures inside the right atrium. This is the interatrial septum, which lies between the right atrium and left atrium. It is obliquely located, that is, posterior part is more towards the right side and anterior part is more towards the left side. That means if you go forward, you are directing more towards the left side. If you come backwards, you are directing more towards the right side. This is opening of the inferior vena cava. This is opening of the right atrioventricular valve. This is the tricuspid valve. This is the opening of the coronary sinus. So if you see very carefully, opening of the coronary sinus is slightly anterior and to the left of the inferior vena cava opening. That is slightly anterior and more towards the left of the inferior vena cava opening and behind and right of the lower part of the tricuspid valve. Behind and more towards the right of the lower part of the tricuspid valves. Coronary sinus receives about 60% of the venous blood from the walls of the heart. Tributaries of the coronary sinus. They are great cardiac vein, middle cardiac vein, small cardiac vein, posterior vein of left ventricle, and oblique vein of left atrium. Number 1, great cardiac vein. This is anterior view of the heart. This is the apex. This is the left border of the heart. This is anterior interventricular sulcus, along which left anterior descending artery comes down. This is anterior atrioventricular groove, along which circumflex artery will go from this to the left border of the heart. Posteriorly is the coronary sinus. Great cardiac vein consists of two parts, first part and the second part. The first part begins at the lower part of the anterior interventricular groove. It goes up right to the anterior atrioventricular groove. This is the first part. After this, it turns to the left up to the left border of the heart. That is the second part. It turns posteriorly and runs along the posterior atrioventricular groove, becomes wider and joins with the coronary sinus. First part of the great cardiac vein is together with the left anterior descending artery. Second part of the great cardiac vein is together with the circumflex artery. Usually, artery and accompanying veins runs opposite direction. But in this case, circumflex artery and great cardiac vein runs towards the same direction from here to this place. So in the body, this is the only part where artery and accompanying vein runs towards the same direction. Next tributary of the coronary sinus is number 2, middle cardiac vein. Let's look at the heart. Here you will see at the back of the heart will be posterior interventricular groove, where the branch of the right coronary artery, right posterior descending artery will be coming down here. Now we are going back to the middle cardiac vein. This is the middle cardiac vein at the back of the heart, running along the posterior interventricular groove, going up and join the coronary sinus and drain into it. The third tributary of the coronary sinus is the small cardiac vein. This is the one small cardiac vein, accompany the right marginal branch of the right coronary artery. Small cardiac vein will drain into the coronary sinus near its termination. Small cardiac vein will drain to the coronary sinus near its end, near its termination. Fourth tributaries of the coronary sinus is posterior vein of left ventricle. This is the one. It runs on the diaphragmatic surface of the left ventricle and drains into the middle part of the coronary sinus. The fifth tributary is the oblique vein of left atrium, also called oblique vein of Marshall. This is the one. It runs downwards at the back of the left atrium and opens near the right end of the coronary sinus. It is coming down from the posterior surface of the left atrium and drained into the coronary sinus. This is oblique vein of left atrium of Marshall. Union of oblique vein of left atrium and the great cardiac vein is the beginning of the coronary sinus. So from where the coronary sinus begins is where oblique veins of the Marshall join with the great cardiac vein, and from here the coronary sinus started. So then it ends into the or drain into the right atrium here. Now we are going to talk about last two sets of veins. Before that, let's see the heart again. This is anterior atrioventricular sulcus between the right atrium and right ventricle. So number 6 set of veins are anterior cardiac veins. They are 3 to 4 in numbers. They begin from the anterior surface of the right ventricle. They cross the anterior atrioventricular sulcus and drain into the right atrium. The 7th set of vein is vena cordis minimi, also known as veins of the Byssus. They are very small and begins in the capillary beds of the myocardium and open directly into the nearest chambers of the heart, chiefly to the atria. Anterior cardiac veins and vena cordis minimi do not enter into the coronary sinus. Anterior cardiac veins will drain into the right atrium. Vena cordis minimi, veins of the Byssus, will enter to the nearest chamber of the heart. That means maybe into the right atrium, right ventricle, or left ventricles. As you know, left atrium and left ventricle contains oxygenated blood because they come from the lungs. But some vena cordis minimi enter to the left atrium and left ventricle, bringing the deoxygenated blood. So blood in the left half of the heart and also ascending aorta are never 100% oxygenated. They are mixed with some venous blood coming from the vena cordis minimi. So do the coronary arteries. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.